Hi, this is Tom Salemi with OIS-TV. I'm happy to be here with Joseph Boorady, the President and CEO of TearScience.
Thank you for having me.
You're now a frequent guest. This is your second time.
I'm enjoying it. I appreciate being welcome back.
Well, the 10th one is free, so
Okay.
keep your card and I'll punch it when you leave. So this is AAO, the big stage of the year. What's your big news? I know you had some exciting news over the summer you want to talk about.
We have some very exciting news. And yeah, the AAO is kind of our Super Bowl of the year. And
Sure.
we work hard towards this. But our big news is really our July 2016 published paper on duration of our treatment. And in that paper, it was found that we were able to, with a single LipiFlow treatment, reduce symptoms of patients by 50% and increase the lipid production, or the gland score, by threefold.
Wow.
And that was sustained over a 12-month period of time. So one 12-minute treatment in the office lasted 12 months. And that gives phenomenal relief to patients, sustained relief, and increased comfort and reduction of dry eye symptoms over that period of time.
Now that lasted at least 12 months. You stopped monitoring at 12 months?
Yeah, great question. We did stop just due to costs. It was a very large study. We used over 200 patients, so about 404 eyes were treated. And because of that, the costs would have been too much to extend that on. But there have been other studies done in the field. Dr. Jack Greiner, for example, has been reporting his follow-on patients up to 4 years. And in fact, I think he found about 50% of those patients at the end of 4 years still had sustained relief. So we do know it lasts quite a while.
That's terrific. And I know we had talked last time at OIS at ASCRS about your different sort of pricing structure and the different way you were selling, and you as a result had a very successful ASCRS. Yeah,
well, and thanks to you, we announced our LipiScan launch at that meeting.
That's right.
And that was really exciting. So we were able to announce to the world that we were releasing this new product called the LipiScan. And the LipiScan is a diagnostic device that is very affordable. It's fast and easy to use. And what's great about it is a lot of practices have been using that for routine screenings of patients. So they're just doing lower lids of both eyes and looking at their meibomian glands and looking for MGD rather than waiting for patients to present with symptoms. They're being more proactive. And so that's been really helpful in increasing awareness and education of MGD. And that product just did phenomenal. The doctors, I'm very proud of our colleagues. They understood the value of that technology instantly. And our sales at the ASCRS were record-breaking. In fact, at that meeting, we sold more devices than the company sold the entire year in 2014.
Wow.
So it was a really powerful tool.
Was there a 2-for-1 deal or something going
on? No special deal. Just, it's a great product at an affordable price.
Yeah.
And that hit the market in the sweet spot. And again, I just want to thank OIS and you for allowing us to launch that at this meeting, because it did have a big impact.
Oh, we love to be part of those kind of success stories.
Yeah.
So you also beefed up your board of directors. You added Ed Holland on there.
We did.
A stable voice.
Yeah, Ed's phenomenal. So Ed, great story. He's just one of our earliest adopters of the technology. He understood dry eye and the importance of treating meibomian gland dysfunction in order to improve your overall outcome for dry eye. And so he's somebody who understood that clinically very early on. He adopted the technology very well. He was able to see the benefits of that in his practice and how it benefited his dry eye patients. And so he's been a strong advocate for many years. And now that we had a vacant seat on our board for an independent board member, it made a lot of sense to bring somebody in who understood business, and he has a very strong business acumen as well as the clinical acumen and understanding of the market. So it's been a great asset to have on our board.
That's terrific, and no doubt will help with sales at AAO. What going forward? Are you doing any sort of different marketing plans, reaching out more to consumers, doctors? What's your next step?
Yeah, great question too. We did launch a website called dryeyandmgd.com, and that website is very consumer focused. And so consumers can log on to that site and learn more about meibomian gland dysfunction and its role in dry eye disease. So that's been very helpful. And in fact, as far as I know, there's been at least 30 or 40 links established on doctors' websites directing their patients to that site, and that keeps growing every month. And that's been really exciting too, because that's the endorsement of our professions to to support that education of the patients who can benefit from it. So that's been a really powerful tool. We also implemented a few different rebate programs this year, and that's been very effective as well, because it gets the patients to help them make a decision faster when there's a rebate associated with it. So that's direct-to-consumer activity that we didn't normally do in the past. So that's all been helpful to get pull through and get patients to accept a new and innovative technology as well.
Excellent. Well, great program. Well, thank you for making OIS part of your success story.
Well, thank you for allowing us.
Okay.
Appreciate it.